Who knows what bespoke means? One person has to know. You know. Okay, we got one. So it's a bizarre term, but I'm going to show you why it's important. So bespoke. Bespoke means custom made based on the specification of the person ordering it, as in a bespoke suit. This is a British term that is out there. However, in British fashion, it started to become used interchangeably with customized, which was more affordable for the mass market. So this actually has a lot to do with British high fashion. However, what has become apparent is that this term is now starting to be used in cancer care. And really, what is bespoke cancer care? It's really customized cancer care, relying on a lot of the things we've been talking about the last 2 or 3 days, including precision medicine and advances in AI technologies. So, bespoking may be how we be talking about healthcare for the individual. We already have a lot of little things that we can do, pharmacogenomics, genetic testing to make sure somebody is going to respond to some of the GLP-1 inhibitors. But really, this term has been brought forward by a group called the Advisory Board. And I don't know if you know who they are. They're a think tank in Washington that advises healthcare systems on kind of what's coming down the road. So this is when I became aware of bespoke cancer care. And really what we're talking about is customized cancer care. It's really just a fancy term, I think, to get everybody's attention. So the advisory board presented this concept in terms of cancer screening, in terms of the patient specifically, in terms of treatments, and lastly, how is this going to impact the provider? So cancer screening, we've already seen this a couple of times talking about AI technologies. There's something here called Unfold AI, which basically lets you just look at an MRI and identify prostate cancer, actually without the need for a biopsy, as we've talked about. The American Association of Medical Colleges has actually had some seminars and large group gathering about AI for screening, and how AI can be used for mass screening. Again, MRI, that's been the big thing for us in prostate cancer. How can you take the MRI image and decide if there's cancer or not cancer, even without doing a biopsy? And I think somebody mentioned this the other day about bladder cancer, but there's actually AI out there for gastroenterologists for identifying polyps. And it's called GI Genius, and it's by Medtronic. And basically, as you're doing the colonoscopy, it will pick out for you a lesion. And in a little bit, it's kind of like our CysView, our blue light cystoscopy in a way. I don't know of anything. Somebody might be aware of something in bladder cancer, but I'm sure somebody's working on it in our world of bladder cancer. So in terms of screening and bespoke care, a paper just came out in the Annals of Internal Medicine, and they talked about cancer screening costs, $43 billion in 2021. And our good friend, the former director of the Jefferson Kimmel Cancer Center, Karen Knudsen, who's now the CEO of the American Cancer Society, was interviewed by the New York Times. And her argument was the cost of screening is small compared to being diagnosed with late-stage disease. So, again, we got to keep our eyes on the moving target of the benefits and the cost of everything. How about bespoke cancer care impacting the patient? Well, this is something that we've been into for a long time at Jefferson and the Kimmel Cancer Center since 1997. We've been doing a multidisciplinary clinic where we're all there, same place at the same time, seeing the new cancer patients. And what I found really interesting, some of you may be aware of the fact that in January of this year, Medicare now has an add-on code, a G2211, which is called Continuity and Coordination of Care, so that if you've been in a group taking care of a patient and you're going to be the one that's going to be providing the ongoing care, you can actually build this code. I don't think it's a lot of RVUs and things like that, but the point is Medicare is recognizing that there is a benefit to cancer care coordination for the patient. How about treatments? Again, we're all on board with this. For example, metastatic castrate-resistant prostate cancer. Instead of just trying abiraterone or just trying a pembrolizumab or something like that, we now will get specific somatic tumor testing and being able to tell us exactly what's the best likelihood of this patient responding to an agent. Or what's really neat, and I think you know about it, they give you a list of all the clinical trials that are out there that a patient may be eligible for. So again, really getting customized cancer care. In this bespoke treatment, the advisory board talks a little bit about learning algorithms to aid in diagnosing cancer, pocket expert AI tools. And I think a great example of this is looking at the evolution of risk stratification tools in prostate cancer over time, kind of coming up with the most recent Artera platform, which uses AI screening of pathology slides to determine, for example, who needs short-term androgen deprivation therapy and who needs long-term androgen deprivation therapy with radiation. Two of the areas that have been really hit by AI and changes have been pathology. This is just an example of global research trends in AI in tumor pathology. You can see basically an explosion in the world of pathology-reported AI since about 2018. And again, if you look at the number of citations, and again, this is through 2021, where it's 180,000, or excuse me, 18,000 citations based on tumor pathology. Again, mind you, this is 2 years ago, so I think that we're only going to see this increase with time. And again, here is the Artera platform that we talked about a little bit the other day. They're a multimodal artificial intelligence platform. Looks at slides, you send the slides to them, they scan them, and they come back with data before you even start to treat the patients, who has benefited from treatment intensification with short-term ADT, or who can avoid ADT at all along with the radiation. Again, I think a big breakthrough, and Artera, as you know, is already in the NCCN guidelines to be used, so they really brought this AI technology forward very quickly. And again, we talked about this a little bit, the concept of theragnostics when it comes to treating patients. And I thought this was really interesting. I never thought about it, but the fifth pillar of cancer care, and I know Phil is here, but is now going to be, nuclear medicine. You've got surgery, medical oncology, radiation oncology, chemotherapy, immunotherapy, and now we have, theragnostics using nuclear medicine strategies. Providers, well, how is this going to impact us? Everything is going to impact us, and how that actually comes down the pike, we're just going to have to see how much we're, as the providers, are going to have to be more and more involved with the care of patients. But I think this is really an important concept as we're going forward. We do not know what most of the genome does. We've done a great job over the last 20 to 30 years figuring out the common genes. But there's going to be a lot of AI work done in the next 10 to 15 years, truly trying to figure out what's called the dark genome. It's actually all this genetic information that's in our cell that right now we can't figure out exactly what it's doing there. We've just kind of scratched the surface, and the estimates as much as 92% of our human genome, we have no idea what is it doing. And lastly, to wrap up on a practical end, who can afford this? This article just came out a couple of weeks ago in the Wall Street Journal. And the cost of cancer care to an individual is really devastating. And the problem is the technology that we're developing is costly. How do we fit this in going forward, making sure that we're friendly to our patients? I think is obviously a question we're all going to have to answer, but certainly at the government level, we're going to have to figure this out. And lastly, just to reassure urologists, if you look at the impact of AI and things like that, you can see over here that major impact right now in radiology. But the good news is that when you look at this snapshot of AI in replacing or assisting physicians, if you come down here to a urologist, right now, no one thinks we're going to be replaced by AI. So with all this neat stuff, that's probably a good thing for us. Anyway, now you all know what bespoke means. So make sure you use that at your next cocktail reception and get funny looks from people. But anyway, thank you very much.